Last September, I was diagnosed with stage 4 cancer and have been fighting ever since then. My name is Xolani Gwala. I'm a presenter on Talk Radio 702 and K-Talk. When I was diagnosed, I was probably one of the fittest guys in the office. I ate very well, I didn't smoke, I didn't drink, but still I was diagnosed with stage 4 colon cancer. And I've seen it even here at work at 702. I can give you over a dozen people who have either been directly affected by cancer or have relatives who are still battling cancer, and in certain instances who unfortunately have passed on because of cancer, and they will be giving you their stories.
I lost my mom to breast cancer when she was 50.
My father passed away from the disease.
My beloved dad passed on.
My father passed away from lung cancer last year.
He had prostate cancer.
My mother, who was diagnosed in 2012 with non-Hodgkin's lymphoma.
My aunt came over from Ireland to help us look after him for about a month, and then she returned to Ireland and a few months later also died of lung cancer.
My best friend to cancer of the stomach lining when she was 34. Currently my sister, Emily, has breast cancer.
And other family members as well, such as two of my uncles.
And my sister-in-law to colon cancer, and she was 51.
I lost my sister to breast cancer.
So I've had quite a few people who mean a lot to me die of the disease.
But a couple of things have happened that have opened my eyes to what is going on around cancer. Firstly, there's a massive issue of access to treatment. Not many people have access to treatment. In fact, if you're not one of the 16% in this country that have medical aid, treatment is almost always impossible for you.
My mom hid the cancer from us as her children, and those were in the days before HIV was the new stigma. It was also because she was a working class woman. She was a factory worker. She didn't have medical aid. She couldn't afford the cancer treatment.
From what I understood from back then already was that treatment was quite expensive.
My sister was treated in a public health care facility. I am aware of how expensive treatment was.
They used to part with around 4,000 rands a month to get that injection.
With regards to my mom's treatment, fortunately she had medical aid. Unfortunately, the medical aid did not pay all of the funds.
In the government sector, you have to wait a lot longer. So if you want help quickly, then you have to go private, but that's only if you can afford it.
Very few public sector hospitals have the capacity to give the treatment that you need. And I think that we need to mobilize society, but also appeal to the public sector and others who can help us influence the policy around the issue of treatment of cancer patients in the public sector.
I think from what I see, there's still quite a lot of obstacles people face in accessing healthcare.
Because you are unlucky enough to be diagnosed with cancer, I don't think it should be a death sentence because you don't have the financial means to cover the cost.
Being ill is regarded as a liability. How can we still have outmoded ways of dealing with this disease? This disease needs a complete overhaul.
Cancer equals death according to what we have been told all the time. It's only now that we know that cancer can be beaten.
Choose to make a positive impact. Lead SA.